like to call to order the March 9th Program and Budget Community Mental Health Meeting. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item is the reading of the mission statement by Megan.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next item is adoption of the agenda. Take a motion to adopt.
So moved. Support.
Motion from Donna, support from Lori. Let's do that. Any questions?
I didn't say anything. I don't know where it came from.
I got it, I think. Questions, comments? All in favor signify by saying aye. Aye. All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Any item on the agenda? And make sure the microphone's on there, Sean.
Good evening. I'm Sean with CEO. I just want to say that in regards to the agenda item 5C, the service expansion proposal, that RFP will greatly affect the community choices that a person served can select from. The proposal will also allow persons served to select paid activities such as going to the gym, swimming, going to dance classes, education classes, museums, to the zoo, and so on. If that RFP is funded, CO will be reporting back to the board the impact that the funding has directly made to the Macomb County citizens. And thank you for your consideration on that.
Thanks, Sean. Anyone else from the public? Not yet. All right, we will close the hearing of the public and move on to item 5A, which is a request to approve, request approval to release a RFP for specialized licensed residential service providers. Take a motion to approve.
Support.
Motion from Lori, support from Megan. It's going to be the Dave show tonight, so I'm
I'm
going
going
to
to
kick
pass
over
it
to
to
him.
Adam, but no.
That's right.
The one thing different about this RFP is that we're asking to keep it open for 12 months. Given the current situation, the shortages we're having, we did send letters out to homes that were certified to support people with traumatic brain injuries. So we might be getting those responses in, and we're doing some more active outreach with other licensed facilities as well. So we would just like to be able to keep this RFP open, keep trying to expand our network to meet the needs.
Megan?
Dave, will you be reviewing them like monthly or quarterly or like as they come in over that 12-month period? Or like you're looking for more than one, correct? So you're going to be like consistently reviewing them so people don't lose interest, I'm assuming.
Yeah, we're going to
Okay.
keep it posted, and we'll keep it
Keep
active
reviewing.
and keep alerting people and keep reaching out.
Sure. Okay, thank you.
Thanks, Megan. Anyone else? Okay, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5B, request approval to release an RFP to complete the Medicaid verification audit. Take a motion to approve.
So moved. Support.
Motion from Megan, support from Donna. Dave?
I messed up my screen here, but this is just a standard renewal. We've been using Jackson Wells. Used to be Fidelis. They just had a name change, but we've consistently used the same provider in this area. It is a contract requirement, and we have to have a third party look at the Medicaid verifications for the services we provide. So it's an expensive service, but it's in depth. They do the random sampling, and then the board gets those reports. So we're just opening this RFP up after, I think it was a 3-year period of time.
Questions, comments? All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5C, request approval on the service expansion proposal for CEO. Motion to approve.
Motion to approve. Support.
Motion from Lori, support from Selena. Dave's working on bringing it up right now. Technical difficulties today.
Trying to get back. Is this the CEO one?
Yes.
Yeah, I don't have, hang on one sec. I should have Sean come back up and tell us what they propose to do. Wants me to leave that. I'm sorry. So I know CEO submitted a number of, here we go. Okay, increase self-esteem, cost. It's a rate differential so that they can have smaller staff ratios to increase the community activities. So it's challenging to take, large groups of people out into the community. So what they submitted and what we're proposing to approve is that with smaller staffing ratios, which would be reflected in the rates that we're paying, they would be able to more easily take smaller groups of people out into the community to engage in those various activities listed there, which are all, I think, very appropriate to what we're trying to increase here.
Any questions for Dave or Sean? All right. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we move to item 5D, request approval on Arc of Macomb service expansion. Take a motion to approve.
Motion to approve. Support.
Motion from Lori, support from Selena or Donna? We'll go with Donna. Dave, go ahead.
There's three parts here for the ARC. The first is their apartment program. So in order to help instruct people about independent living skills, they would model that directly constructing an apartment, I believe, at in their office space there. There's more detail attached. The YMCA program, we spoke about highly. What we're able to do is the Y for All program allows the individual and a family member or even a paid support staff to attend all of the Y activities for 1 year for a more than reasonable administrative fee. The ARC agreed to administer those 100 memberships, and the YMCA agreed not to start the year until the membership was issued. So it's not like we have to try to get everybody set up in April and they have 1 year. It will be individualized. They did also agree that if I started my membership and I only did it for a month, that they could pass that membership on to somebody else to continue out. So we're looking forward to this. The YMCA is very much a part of what we're looking to do, which is integrate people into their communities. The Y is open to everybody. All of their programs are focused on inclusion and healthy living, and it's a really good partnership. So if this goes really well, we would definitely like to continue it, and maybe even do some, get some outcomes and things like that on this one. The third is What's New with You, which is an educational podcast and webinar series. The cost is detailed below. For the apartment program is basically the equipment. The Y memberships are $39 a month for 100 memberships, plus the small administrative fee to the ARC to help coordinate all of that. And the podcast, again, is a small amount with some ongoing costs for the podcast equipment. Yeah, I'll leave it at that. But
Thanks, Dave. Lisa, did you want to add anything? No? Okay.
Please.
If you want to.
Should wait to see how you vote.
Questions or comments from board members for Dave? Lisa? No? Okay. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5E, request approval to provide a rate increase to contracted hospital providers. Take a motion to approve.
So moved. Support.
Motion from Megan, support from Donna. Sure. Dave, go ahead.
This item is specific to the My Health Link program, which is the dual eligibles, Medicare and Medicaid. I spoke to it at our last meeting. The federal government, CMS, had a pricer that they issued out that allowed us to calculate our My Health Link rates for the inpatient stays. They stopped that. So we waited to see if they would issue that. They have not. So in order to process some back claims and to keep things going forward, we're proposing a flat $850 per diem. And that was based on the information we received back about the typical Medicare rates to a hospital. There is a level of care adjusters, so there is no one rate. It ranges from about $790 to about $950, $960. So we just try to hit the middle target there at $850.
Questions for Dave? Comments? Selena?
I will not be partaking in this.
No.
Okay. Thank you.
I thought you were going to ask me a hard question on that.
Got off easy this time. All right, seeing no other questions, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes with Selena abstaining. Next, we'll move to item 5F, request approval of the Mahalik Group Consulting Agreement Addendum, which is pending legal approval. Take a motion to approve pending legal approval.
So moved.
Support.
Motion from Megan, support from Antoinette.
We do have a signed agreement with the Mahalik Group, but what they did was they completed their readiness assessment, they presented their findings, and now they presented a work plan for the next 24 months, which I've agreed to and will be making into a regular part of our strategic planning process for the next 2 years. What they've done is broken the remainder of these activities down in more detail with the hourly rates. So it's just like a step 2 of the contracting and work plan process. We will be purchasing some additional work product from them as well, and we do need this approved and signed in order to get those. There are certain documents that are scored, that are weighted heavily in your scoring. And they could work with us and we could work and design it, give it to them, have them, suggest edits and go back. Or we could purchase from them a completed product that we know meets all the NCQA requirements. So for some of this area, I'm strongly making those recommendations, and that'll be based on that a la carte fee schedule that's attached there as well.
Megan?
So this is a question for this one, and then for the other items too that just say pending legal approval.
Mm-hmm.
Did we get another Aaron Thomas, or did we get a replacement Aaron Thomas? Is that
That's in
okay?
my update report later, so stay tuned.
Gotcha. I was wondering. Thank you.
Anyone else have questions pertaining to the right now? All right. Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. If it's all right with the board, I'd like to lump together items 5, G, H, I, J, and K, or we can take them individually. So, motion from Donna, support from Selena. And before Dave gets started, if you noticed on some of the documents, some were approved by Aaron before he left, and others are just sort of hanging out there, but they all were approved by Corporation Council John Shepka did approve those that Aaron's name is not on. So go ahead, Dave.
Thank you. Tracy Smith sends her regards. She's not feeling 100%. What these all are, I think she actually spoke to these a little bit too at a previous meeting. These are psychiatric staffing agencies that we are able to utilize as needed. They were all based on companies that have contacted Tracy. And any of these agencies that contact me, I get lots of emails about, hey, we've got all these people available to help you. These were the most reasonably priced ones. They were all at $250 an hour or less, and that's how they were selected for this process. So we're asking approval to have these agreements in place to allow us to use them as needed to make sure we have the psychiatric services available to meet the needs of our community.
Questions on these items? Thank you, Donna, for going over that with me earlier, and Sandy for giving us the Corp Council answer. All right, seeing none, all in favor of approving items G through K, say aye. 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 All opposed? Motion passes. Next is item 5L. Dave gets a break. Request
I get a drink some
request
water.
to approve MedVersant contract draft version pending legal approval. Take a motion to approve pending legal approval.
So moved.
Motion, motion from Megan, support from Antoinette. Stacy, I hear this is you.
MedVersant is a credentialing verification organization, and as we went down the trail with NCQA, it became very apparent that the utilizing an agency of this nature would assure that we are compliant with all the state and federal regulations associated with credentialing and privileging. Our current process is very cumbersome and time-consuming and actually difficult to get through. Previously in the year, Oakland County, one of their board members had reached out to Dave to say, hey, do you have a company that does this for you? And they have contracted with MedVersant, as has Detroit Wayne. We went down this road with 5 other agencies. Amy Briney and I met with several of them, asked them to show their product. We met with this group. One of the things that MedVersant does that the others don't is they actually create provider profiles. So when you go to our website and look at providers, who we have available, what types of services they provide, what languages do they speak, are they accepting new referrals, we don't have all of that detail, and we're required to have that detail for NCQA. So this is a group that kind of rolls it all together. We were in the stages, we've gone through the demos. You can actually see their product, the way it's implemented in another prepaid inpatient health plan if you go to Detroit Wayne's website, because they can roll it into our current internet page. So we're requesting that you allow us to continue going down this path and seek legal approval for contracting.
Thanks, Stacy. Donna?
Yeah, as I went through this contract, the one thing that I noticed that was a little bit problematic for me was that the Schedule A, which was the statement of work, didn't have anything on it. The description of services to be provided was blank. So, and you know, I'm pretty knowledgeable about privileging, and so I would be hesitant to approve it without having a description of services. Was that left out for some reason?
It's because I asked them to pull it together very quickly. And I've had 3 subsequent meetings with them where they can provide the additional detail that would go along with that when we send it to legal for approval, that would identify much more about the scope of work and what they'd be providing to us. But we literally on a Friday morning, I said, hey, I can present this at program and policy. What can you pull together for us? And like I said, Friday night I met with them, got some additional detail, met with them again yesterday, met with them on Monday. with regard to this.
When are they supposed to be providing the Schedule A statement of service work to you?
Dave's raising his hand.
Through the chair, what we're requesting today is that you forward this to the full board for
Okay.
approval at that time. And it's our full intent that in that interim period, we would get that detail, have Corp Counsel review it, and get that all to you ahead of the full board meeting. For timing purposes, we were, I realize you have a more of an outline contract in front of you, but it's our intent to get that additional detail between now and the 23rd.
Okay, thank you.
Thanks, Donna. Anyone else? All right. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is five. Do you want to go before I start up?
No.
Okay. Next is 5M, request to approve MCG contract, Third Amendment relicensing agreement, also pending legal approval. Take a motion to approve pending legal approval.
So moved. Support.
Motion from Selena, support from Lori. Now you can go, Dave.
This one, I really wish Adam was here. Adam has been our point person working with MCG. For parity purposes, we had to implement a consistently applied utilization management, utilization review platform. So I believe 8 or 9 of the PIHPs are all using MCG. It's a software platform that runs parallel to our focus system so that when our MCO staff are doing primarily the hospital reviews, there's a set of questions that you have to go through that lead you directly to your decision-making process. So it's intended for the inter-rater reliability should be higher, the consistency, the documentation trail. So it's a national platform. We've been using it. I've been here since December of 18. I think it started right around that time. I know they were looking at the contract right around the time I started. So this is just a renewal of that agreement. That's what we're looking to continue.
Questions? We can ask Adam when he's here next time. All right. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is the final item, 5N, request approval for out-of-state travel, conference attendance for 3 employees. Take a motion to approve.
So moved. Support.
Motion from Megan, support from Lori. Questions, comments on this one? It's all in your packet.
I don't get to travel, so.
Yeah, Dave's not going anywhere, so.
Can I ask?
Megan, go ahead.
Thank you, Phil. Is this the one that got delayed that you were unable to go to for a while? This is a whole new one? Okay. Thank you.
Anyone else?
We do have, it's Ann and Sabrina who are key in our CCBHC. So I did approve their conference request, and then the third one is for Stacy.
Anyone else? All right. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Out-of-state travel granted. Next is receive and file. We have no items there. Item 7, resolutions. None there either. And then we will move on to item 8, other possible agenda items. And we'll start with A, customer service update from Chanel Moore. Dave says yay.
Good evening, everyone. I am Chanel Moore. I am the Customer Service Administrator at Macomb County Community Mental Health, and I've prepared the report that you have before you in your packets this evening, and that highlights all of the progress that we've been able to make in customer service since the inception of the department in March of 2021 through the end of the last fiscal year. So it identifies the key performance indicators, as well as the customer service metrics and things that we strive to achieve to serve the customers of Macomb County Community Mental Health. Any questions regarding the report at all?
Dave was excited. He thought you were going to go for like 10, 15 minutes.
I can read the report if you'd like.
I read it ahead of time. so-
Okay.
Anybody have any questions, comments, anything?
I have some comments.
All right, Dave, go ahead.
This really is just, I can't say enough nice things about Chanel and the changes that since she came on. When I started, nobody was answering. I have to correct that. We were not tracking the phone calls very well, and there was some very long hold times, and trying to get my arms around that was difficult. Chanel came in with her background and experience, that the customer service department really is a shining star. The outcomes, the data we get, the consistent improvement over time, and just to know now that people are, we're answering those phones quickly. She's grown the department, so great job. Thank you.
Thank you. It's truly my pleasure to serve.
Chanel, I have a quick question before you run off.
Sure.
So, since nobody else has it, the phone metrics chart, October 20, about almost 10,000 total calls coming, and then September of 21, it's like half of that. Is there, and I noticed the abandon rate changes, and I'm wondering if that's because there's fewer calls coming in, or what's that I can't even speak. You know what I'm saying?
So,
Correlation. That's the word I was looking for.
Sure, I could explain that. So prior to my joining the organization and beginning to track this customer service data in March of 2021, there was a compiled source of data that is why you see the high call volume in October 2020, and then you'll notice in June you'll see that it just tracks the CSRs, or customer service representatives. Prior to that time, they were recording the managed care teams of mental health and substance abuse, and there are additional paths that were also in that metric. So we began in June of 2021 to track only customer service metrics. And since that time, we have consistently met the KPIs that are put before us.
Thank you. The numbers are significantly better. It's awesome. Thank you so
Thank
much.
you.
And to your team, too. Thank you.
Thank you.
Megan?
Again, like everything Phil said, I feel like we all feel that too. And I do feel like, my full-time job is in public service as well. And I feel like we expect a certain level of service when we go to Taco Bell or we go to a hotel or something. But I feel like too many times in this kind of arena, customer service gets overlooked. I know everybody 1,000% is overworked. You don't come into public service to be a bajillionaire. But I just really appreciate the numbers. Like Phil said, I think that stuff like that is what sets us apart, and I feel like that level of service is what sets Macomb County and makes us like the shining star. So thank you to you and your team. You guys are amazing.
Thank you. Yes, we certainly have an amazing team. They
Yes.
work really hard to serve, and it is truly, again, our pleasure.
Donna, see what I started? Donna, go ahead.
And I want to say I especially think it's important for the type of people that are calling. I mean, in so many areas of their life, they're ignored, they're passed by, and I think it's exceptionally important for them to be recognized and paid attention to quickly when they're calling us or when they're seeing us or when we're quickly responding to them. I think it just means so much to them. Thank you so much.
Agreed.
Because I think when that phone keeps ringing and nobody's answering it, it's the way life has treated them. So I think it's really important that when we answer and we respond to them quickly, it says, we recognize you and we know you're important. Thank you so much.
You're very welcome. Thank you.
Thanks, Donna. Spot on. Anyone else? All right. Thank you.
Thank you.
Next, we have a communications update from Kathleen.
I will be quick because there is information in the packet. I just basically wondered if you had any questions, but wanted to show everybody the bags that I forgot to bring last week. That very enthusiastically received by the staff. So thank you very much. And the last of them left my office today. Yeah, I can see the window now. Very excited. I had 50 boxes there. There were 2 things in your packet from me. There was a letter that gave you, it was a full-page letter, but it was a short synopsis of what transpired since the last board meeting and this one. At the end of the meeting, Ryan Fantuzzi had suggested we do something to reach out to the Ukrainian community. He thought a newspaper ad might be a nice idea. Dave came up with a different idea, and it started with a Friday afternoon phone call. And he had, 2 days after the board meeting, he said, why don't we do a roundtable? We brought everybody together on Monday for our first planning meeting. We had our second planning meeting on Tuesday, and we had the event on Wednesday. And we had, yeah. It was an adventure, let's just put it that way. But the really great thing about it was we had WWJ Radio show up, Channel 2 and Channel 4 were there. Channel 7 did a report after the fact, and it really helped. I hate to lead with spread our brand, because it did, but I think more importantly, it showed that there were resources in the community, and it really did resonate with people. I know that, I think it was Thursday, both Phil and I heard from a state senator's office that wasn't even in Macomb County that said, we have some constituents who have family that are trapped in the Ukraine, and they're stressed beyond belief, and we would like to know how we get them some help. And we said, call us. They said, but they live in Livingston. We said, we will help them. And so the interesting thing was Channel 7 was not there that day, but then they did a follow-up, and they interviewed our county executive on Thursday, and we were able to provide him with that anecdote, which would have been really great in the story. They had shifted the report of the story by the time it added on Friday, but still, it was still wonderful to know that we were able to get out there and reach people with that type of message. So, the second, so if you had any questions about that, so good, no questions, move on.
No? Kathleen, I have one real
okay.
quick. Can you send this letter to us digitally? Because I know I'd like to send this to the Board of Commissioners, all of them, so they can see the links and what was done and everything. I was going to bring it up at one of our meetings, but this is far better than I could have done. So that would be helpful. And thank you for helping me with that Livingston County issue last week.
Well, I will admit there was a moment of panic when I looked at it, and it's like, how do I know how to help? But it was no, they needed some help. And hearkening back to Chanel, it was really nice to be able to say, call our team. I know they will help. And if they don't call me back, knowing they wouldn't call me back, because I knew our fantastic team would handle it. So it worked out really well. The other item that was from me in your packet, that Sandy was kind enough to bring paper and electronic copies, is we'd like to invite you to come 3 weeks from today. You're off Wednesday, I know, I'm sorry, but to come and see our administrative buildings and also have an opportunity to update your headshot. We'd like to show you around. We will have some type of refreshment. We haven't gotten that far yet in our planning, I'll confess, but we will have a photographer there who will, we'll get everybody through quickly, but we'll give you time to really be comfortable with what images. I tried my darndest to find somebody who would make us all look 20 years younger, 20 pounds lighter and all that, but I did get somebody who will let you choose 2 images and offers some retouching. We'll bring some nice soft lights, so. I know. Some people will look like they're in grade school, I know. But
Can we go with 5 years younger, maybe 10?
We're going to age you, I think, give you some gravitas with some gray or something, I don't know. But I wondered if you had any questions about that. Okay, well, thanks for your time. And
Thanks,
I will
Kathleen.
email that to you tonight.
Thank you very much. All right, with that, we will move on to the CEO update, so Dave can speak a little bit more.
Well, you approved the out-of-state travel for Ann, who I said was key to our CCBHC program. I didn't notice her at the time there. Ann, why don't raise your hand? Yes. You might know Ann from the roundtables at the CMHA conferences. on the CCBHC program and stuff. She's our program coordinator for that project. Yeah, thank you. The Ukrainian event, the roundtable event, I do have to thank Kathleen. She put in some extra time over the weekend. It wasn't just, the timeline was a little bit more than what she described in there. It did come together very well, and we were flexible, and we were able to connect well to the media before the official roundtable. And the message from the roundtable was very powerful. Dr. Ward did a really good job of covering the trauma and how to address that with both adults and children. So it just speaks volumes. We have a very good team to pull something like that together. And we did have Mark Hackle there with us the entire time. Weren't sure about that, but yeah, it was, a great event, and we did have Oakland and Wayne came along willingly with us, so it was a good regional event as well, so thank you. The Corp Council. We did lose Aaron Thomas, and we are feeling that loss. We have reached out to Corporation Counsel. John Shapka has been very open and helpful during this process. They did post that position, and I believe he was reviewing the applicants on Monday of this week, or starting Monday of this week. I did speak to him and to the county executive office about our needs specific to the community mental health. And we've started the conversations about us having a dedicated corporation council member for us. It's got positive energy with it right now, and I'll keep you posted about that as we go along. Very much in favor of that because of what we're working with, the changes that we're undergoing with the NCQA, all the policies and procedures. On the compliance side, there's a lot of questions, and we would benefit greatly from having more direct contact with an individual in that role. So keep you posted.
Is it okay if I interrupt and ask now? Was Aaron Thomas dedicated to us, or was he multiple departments?
He was multitasking.
Oh, okay. Thank you.
But yeah, very key to our operations. The Shirkey bills, I continue to send those updates that come out from Alan Bolter at the association. We have made local contacts. We're trying to advocate as best we can. Lori, I did follow up with the superintendents. I just have not heard back yet on anything. So thank you for that connection. Where we stand is there was some yes, I'll support you, and then some things changed. So we do have to continue those contacts and make those efforts. The clock is ticking, and it's really one of the most important things on our plate right now. So I do appreciate all the efforts that you as individual board members and you as commissioners have done, and we're not out of the the woods yet here on that one. We did hold the MCHE annual meeting. It was very brief, really nothing to report from that meeting. But just as a reminder, the board is the member of that organization, and I represent you on that. And it's 9 of the 10 PIHPs, and we look at those collaborative opportunities, and it's a very good group to work with. So the state restructuring kind of came at us quickly. They called us together last Thursday at 4 for the statewide meeting, and they issued the slide deck came out the next day. It's a major overhaul at the state level. We're not quite sure what to make of it yet. I don't know if they're quite sure what to make of it yet. So we'll be working together to make some of those new connections. The big changes, of course, are Farrah Hanley is now the director. They added a children's department in response primarily to the KB lawsuit at the state level, and it's appropriate that there be a special focus on children's services. The rest of it, like I said, we'll need some time to kind of work our way through those new connections. So I'll be happy to report on our progress in that arena. They've also, on the side of the state, they're very open, and they'll be, I'm sure, setting up opportunities for us to make those new connections. They have canceled some of our normal check-in meetings at the state level while they go through the restructuring, which is set to be official on March 21st. Farrah Hanley did become the director on March 7th, so she's already in place. The staffing crisis continues. The impact on our residential and hospital providers especially. It's, the things are getting a little bit better for us out in the community, and the mask restrictions are a little bit better, but the staffing crisis is still, it's still hanging on with us. So I can't thank our providers enough, our staff, for sticking with us through this. I have met now with McLaren Hospital and Henry Ford. They're dealing with a lot, and we do have individuals who are being very unfortunately impacted by not having the residential supports needed in the community, or they can't find an appropriate inpatient bed to, in a timely fashion. And it's primarily due, some of these predated the pandemic, but they're definitely now worse, and there's more people being impacted. So we continue to track that, to get as creative as we can, to work with our counterparts at the state. Unfortunately, there were work groups at the state level about staff shortages, and now there's this restructure, and I'm not sure if that's going to continue to go through there or not. There has been statewide support for continuation of a direct care wage to help on the financial side, but you'd actually need people to be in place to benefit from the direct care wage. So again, thank you to our providers, thank you to our staff who are in place, and the new folks coming in to help out. But I would be neglectful if I didn't say it's not all sunshine and rainbows. We're people being impacted right now. DCO. My comment on Stacy's presentation. The credentialing verification organization under our CCBHC, we have to do the third-party billing for all the staff on the provider side who are providing services under that. So we will have to now credential those individuals and have that on file too. So that's another level. We do need it ourselves for NCQA, and we're putting a lot of staff time and resources into that process now. This will actually streamline that, and it'll be much easier to track information, get reports. So it's both at the designated collaborating organization level and us at the NCQA level. DCOs. DCOs under the CCBHC are. Guess those are my updates for the last couple of weeks. Happy to answer any questions. Thank you.
I don't see any. Thanks, Dave. Couple quick reminders. We have a personnel committee meeting this Friday morning at 8 a.m. at the new CMH admin building. We have full board Wednesday, March 23rd, here at 6 p.m. And if you have nothing to do tomorrow at 3 o'clock, you can come here. We have applicants, so many applicants, about 19 applicants applying for the board. And it's funny because when I started as a commissioner, we didn't have enough people to fill the vacancies now, and we have a good quality applicants too. So 3 o'clock here tomorrow. Anybody else with any other items? Megan, go ahead.
So I am up for reappointment tomorrow. And unfortunately, I had already told Phil and Sandy I'm not going to be able to make the meeting on the 23rd. I have a training out of the area. So I just wanted to say, if this is my last meeting, I have so enjoyed working with you guys all. This has been such a pleasure, everybody. I know, look at Stacy, she just appointed me to that commission. Fingers crossed.
Surprise.
But I did just want to say it has been such a pleasure to serve the community, to serve alongside you guys, and this has been just a truly wonderful experience. So hopefully I get it, but if not, somebody fabulous will fill my shoes.
Thanks, Megan. We hope you don't go anywhere. Well, I hope you don't go anywhere.
Hopefully you have 2 votes.
Anyone else? All right, we'll move on to hearing of the public. 5 minutes.
They thought they were going to escape. Lisa Lapine, Irk of Macomb, 44050 Gratiot, Clinton Township, Michigan, 48036. So I made myself so popular with a local senator's office, I was invited to a fundraiser on Monday night to speak about my opinion regarding 597 and 598 with Senator Shirkey. And I wanted to point out that the lobbyists spent a lot of time with me. It was like being back in law school and having a Socratic method. But one of the things that was most fascinating to me is the lobbyists were really pushing this idea with me as a provider that they could pay me more than you guys pay me. And I kept thinking about that and thinking to myself, I don't buy into that. I don't believe that. But it was one of the more interesting pieces of information I heard about 597 and 598 while I was there. I am aware that the board had taken consideration of rate increases. I provided, on behalf of the Provider Alliance, a lot of information regarding the Tri-County area and reimbursement rates in the Tri-County area. But just as a point of information for you folks as you go forward and you talk about 597 and 598, understanding reimbursement rates in the structure is really, really imperative, especially when you're talking to those lobbyists, because I also had a really fascinating conversation about why I can't get folks into the community and their opinion about why that was happening, which all had to do with only the staffing issues, nothing about whether it was paid for through transportation or anything else. So just as an aside, it was one of the things I learned, and as we try to argue 597, 598 and why we shouldn't vote for it, that was important. An important piece was this provider, we can pay you more than what CMH is providing you. So just a thought. Otherwise, always more money for providers. Yay, that's what we need. Staffing is, we raised our rates to more than what we're being paid per hour. We saw an initial increase in applications, but not much. And the difficulty is that I really can't afford to pay. I'm just kind of on a hope and a prayer saying I have to change what I'm doing to provide really quality supports to folks with developmental disabilities and intellectual disabilities in Macomb County. So just, I do know that there was some conversation at the last meeting. I wasn't present, so I don't know exactly what it was. I thank you for any consideration. I thank you for any consideration you can give in the future. I do share many of those people who are residing in emergency rooms that are not going anywhere. Would be ecstatic to create new living arrangements where I'd love to beat feet to find some property if I could find some staff to provide for it. I think we could get really, really creative and do some awesome stuff. So just, that rate increase is something that we have to have. And thank you for hearing from me today.
Thanks, Lisa. Anyone else? All right, we will close the hearing of the public. Take a motion to adjourn. Motion from Megan, support from Selena. All in favor? Aye. We are adjourned. Thanks, everyone.